Hi, I'm Dr. Brian Kaufman, a retired family doctor and a CLL patient myself. I'm the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society, and I'm going to be presenting the most important abstracts from the European Hematology Association annual Congress in 2024, the stuff that patients should know about. And what I'm going to talk about now is repeated COVID-19 events in patients with chronic lymphocytic leukemia. And I'm going to start with the bottom line, and that is that there's a more than a 1 in 5 chance of a chronic lymphocytic or CLL patient getting a second COVID infection within about a year of the first, but generally it is pretty mild. The good news is that there was no deaths or ICU admissions with that second infection. This research was led by Sara Pepe, who was one of several researchers from Rome, Italy, to present this research at the European Hematology Association's annual Congress, or EHA 2024, in Madrid. In the way of background, COVID-19 infections occur commonly in the general population, and they can be recurrent. But there's little data on the frequency of the reoccurrence in CLL patients who may be at higher risk due to their compromised immunity. Let's look at the methods and participants. This was a retrospective study of CLL patients from a single institution in Rome, Italy, who had experienced a first COVID-19 infection between March of 2020 and September of 2023. Reinfection for this study was defined as a new COVID-19 diagnosis occurring at least 90 days after the prior event. Let's look at the results. 220 patients with CLL who experienced COVID-19 were studied. 95% survived the trial period. It's interesting to note that 78 or 37% had an additional dose of the SARS-CoV-2 vaccine approximately 6.6 months on average after the first COVID-19 event. So 37% got another vaccination after getting the infection. Here's what we want to hear. A new COVID-19 infection was recorded in 52 of the 210, or 25% of the patients, after a median follow-up of just a little more than a year, 12.2 months, ranging from 7.5 to 18.7 months after the first event. All of these occurred after the new Omicron wave. What that meant is the 12-month second COVID-19 free survival probability, was 78.8%. And in other words, less than 8 out of 10 patients lived for 1 year after a first infection without getting a second infection. Factors that increased the risk of the second infection sooner were multiple comorbidities or other illnesses besides the CLL. Here the hazard ratio was 2.4, meaning nearly a 2.5 times higher risk of a second event. Active treatment for CLL had even a higher hazard ratio of 3.54. That's a 3.5 times the risk. And having TP3 mutation aberrations increased the risk, almost doubled the risk. Not surprising, there was no protection against a second infection seen with Evusheld, as it really didn't protect against the variant seen causing the second infection. But it was somewhat surprising that the addition of that second vaccine that 37% of the patients got did not reduce the risk. At the time of the new COVID-19 event, 44% of the patients were on treatment, with most of those being a BTKI, 79%, and the remainder mostly venetoclax. Comparing the first event in the 210 patients to the second in the 52 patients, the second event was associated with a significantly lower risk of pneumonia, 8% versus 21%, and a significantly lower risk of hospitalization, 10% versus 25% with the first, compared to the first group. Moreover, no patients who had a subsequent event that required admission to the intensive care unit, ICU, and thankfully there was no deaths in the second COVID-19 cases. There was greater use of antivirals and antibiotic therapies in the second event, as more of these therapies were available and better understood. So let's look at this, make some conclusions, and discuss what we found. I'd start by saying it's never wise to generalize about COVID-19 infections, but it does seem that at least for those CLL patients seen at the hematology unit of the Sapienza University of Rome between March 2020 and September 2023, there was about a 1 to 4 to 5 chance of getting a second infection following the first infection. Other illnesses or comorbidities, and especially being on treatment, significantly increase that risk. There are many possible explanations besides the direct effect of the drugs and the comorbidities. Such patients may require more clinical hospital visits, increasing their risk of exposure when they're going to see their doctor about their medications or their other illnesses. Or more simply, the same lifestyle and decisions about wearing masks and other protective measures that led to the first infection may have also led to the second infection. The good news is that the second cases were generally mild. Again, there are many possible reasons, including all of these infections are Omicron, which is now known to be generally a variant that causes more of an upper respiratory or cold-like infection rather than the more dangerous lung infections seen with the dominant strains earlier in the pandemic. More treatments and better treatments were available for that second infection. And clearly, immunity from the prior infections and vaccinations may have provided some protection. How these data relate beyond Rome is not clear, but I would bet that this experience of a high risk of a second bout of COVID within a year of the first, coupled with a very low risk of it being serious, is the general experience across the globe. We provide a link to the abstract titled Repeated COVID-19 Events in Patients with Chronic Lymphocytic Leukemia if you want to delve into more details. For more information on COVID-19 and CLL, I recommend that you visit the CLL Society's resources and news on our COVID-19 homepage. Thanks for listening. Stay strong. We are all in this together.